Good afternoon, all. So, as per your knowledge, UK NMC is going to reduce the IELTS and OET scores for nurses because they need a lot of nurses in the coming 5 years. I think around 5 lakh of nurses they need, and as per the current system, the nurses are really struggling to achieve IELTS and OET scores. So currently, the for IELTS they need around 6.5 for writing and LRS listening, reading and speaking 7. So that means triple 7 and 6.5. That's the IELTS band score for nurses. And regarding the OET for writing, they need C plus, and for the remaining three modules they need B. So that's the overall band score requirement now, and most of the nurses are really struggling to get or to achieve this particular band score. That's why they are just conducted one meeting on 26th May. I think you all know regarding that particular meeting from so many websites and all. So what was the outcome of that particular meeting? They just opened one public consultation. That means like a opinion poll we can see. So we can able to update our opinion regarding the proposals which they put forward. First of all, what is our opinion regarding this proficiency test like IELTS, OET? These all are the proficiency test, English language proficiency test. That is the first step we want to achieve if you want to move on to any English speaking country in this sense. So what's your opinion regarding this type of proficiency test, whether it is needed or not? And the second thing, whether they want to reduce the band scores. So that they just put forward some proposals. The first thing, employer reference letter system. If the employer certifying that this particular employee have good command over English, they know how to handle different situations, so we are not coming over to the same situation all the days. Maybe stressed situation, the person may be in aggression, so many different situations. The nurses in the sense they want to go through different situation, so this particular employee know how to handle the patient during different situation. They have good command over English. If the employer certify this in the sense, that is called the employer language referral system. So in the sense the person don't want to write the IELTS and OET. Especially this will benefit persons who are working under the senior carer visa. So there are a lot of people who are working under this clinics and all without IELTS and OET. They just working under the carer visa and all. So this will benefit that particular group, and also those who are working in other English speaking country without IELTS like the Malta and all. Now only the Malta, that means for working as a registered nurse for Malta also they need 5.5 they are asking now. So there are a lot of nurses who already went and they already working in Malta and all without IELTS. So that type of people also benefited by this particular thing. If their employer certified that this person having good command over English, they can directly move on and work in UK without IELTS and OET. Okay, and the second thing is the mode of education. That means during your education period, during your nursing period, if you already done your PG, MSc courses and all in the sense, that medium of communication is already in English in the sense you don't want to write IELTS and OET. As per the current system, if you're passed already, you completed your BSc or the postgraduate or MSc degree or anything more than that, they need to write IELTS and OET. So as per this proposal, if they are, that means if they are accepting this proposal in the sense, the person don't want to write or appear for this IELTS and OET if they already done their education in English language. So we know that in UK they are providing some students visa like that. That means the if the medium of communication in +1, +2 and they having good score over English language in the sense they don't want to appear for IELTS, and can directly appear for one Skype interview. During this Skype interview they will evaluate these four skills and they can directly move on to admission procedure. So like that one thing is there under students visa, but it is not applicable for this nurses and all. So as per this proposal, they are just putting forward these two, three things. What's your opinion regarding this IELTS and OET, like that proficiency test, whether they want to reduce the scores? The second thing about this employer reference system, and third thing, the medium of communication. Your education completed in English language, in the sense you don't want to write the IELTS and OET. So for these all proposal, we can able to respond to these things. That means they opened one portal under NMC website for 8 weeks. That means for June, July month. So we can also reply for this. You can just put your comments over these proposals. After evaluating these public reviews, they will come out with a good conclusion during the month of August. So no need to wait till August month and all. So maybe if they are reducing the scores, the exam will be more difficult. We can't able to predict about the things and all. It's better to give on your exam. If you are confident about your language, in the sense you can just give your exam and move on with your dreams. So that's regarding the updation from the NMC. Thank you so much for watching, and I will come out with more videos to help you out in your real exam. So I'm getting a request because now we are concentrating only on IELTS, but we are going to start with the OET section soon. So stay tuned for that, and all the very best for your exams and also for your dream. Thank you so much for watching. Stay tuned.